Hello, I'm Dr. Brian Ragel. I'm a board-certified neurosurgeon here at Rebound Orthopedics and Neurosurgery. I grew up in Portland, Oregon on Mount Tabor. As a child, I was always outdoors playing baseball and soccer. I'm really passionate about spending time with friends and family. I really enjoy watching my kids grow and come into their own, son in college, daughter in high school. And I still have quite a few friends that I spend a great deal of time with from high school and college. And then finally, my parents and spending time with them. And it's been fun going through life with these people, marching along through good and bad times, watching kids grow, my cohort grow older, and then finally with my parents as well. So that's what I enjoy doing is spending time with people that I love. I earned my undergraduate degree at Oregon State University, BS in biology, and then went on to medical school at Oregon Health and Sciences University. Thereafter, I was at University of Utah for both my fellowship training and residency in neurosurgery. And then following that, I spent time in the military, academics, and now here at Rebound finally. And of all the things I've enjoyed or most proud of, I'm most proud of my military service. So I chose to go into medicine because after I broke my wrist when I was 12 years old, I really admired the physician who treated me in the emergency department, setting my wrist, as well as the emergency room doctor, who was just really kind and caring. But when I reached medical school, I was mentored by Dr. Ed Frank, who was on faculty at Oregon Health and Science University, and really admired his work. And so I gravitated to neurosurgery based upon his mentorship, as well as some research efforts that I was doing at that time. So it was a blend of what happened in my life, who mentored me in my life, and then finally just gravitating to an interest in the neurosurgical problems that exist when dealing with the central nervous system. Rebound is the premier multidisciplinary clinic here in the Pacific Northwest. We treat each patient involving orthopedic surgeons, neurosurgeons, physiatrists, as well as physician medical rehabilitation physicians, as well as our physical therapists. And we really focus on creating an individual plan based upon the needs of the aging athlete, the run-of-the-mill patient who just needs some help getting a surgery to get them through a current back pain episode or leg pain episode, or something simple as just maybe getting an injection or physical therapy to get them through this episode without surgery. So we really try to tailor our patient goals and outcomes on them specifically as an individual. We're able to do that because of our multidisciplinary group. Neurosurgery is a blend of precision, challenge, and an opportunity to really make a difference in people's lives. I've had the opportunity over the years to serve my country as a flight surgeon before going on to a residency. And since that time, I've really delved into both spinal cord stimulation, which is my most recent passion, as well as my research fellowship, which was in brain tumors. Spinal cord stimulation is more of a recent passion of mine within the last 5 to 6 years. It's been a culmination of providing care here in Southwest Washington for patients with chronic pain. It was a need that was identified surgically about a decade ago, and our physiatrists started to do the trials for spinal cord stimulation in patients who had failed conservative measures like medications and physical therapy. And because of the need for it to permanently implant them here in the Southwest, prior to this we were referring them on to Portland, I picked up this as an opportunity to do this surgical procedure, which I found to be very rewarding in that it seems to work as well or just as well as traditional spinal lumbar fusions in patients. And so with really quite a bit of a less morbid procedure, less morbid surgery, we're able to achieve the same amount of pain relief with less risk and less surgery. So spinal cord stimulator is used in the context of chronic pain, which is defined as pain lasting greater than 6 months. It's an implantable device that we can put next to your spinal cord, and it delivers a low pulse energy which confuses pain pathways. And we can think of it as similar to a cardiac pacemaker, as a kind of a pain pacemaker, just to your spinal cord. And the candidates for this are patients who have failed things like medications, physical therapy, chiropractic manipulation, acupuncture, kind of the traditional route for treatment of back and leg pain. And when those conservative measures had failed and imaging shows that there's no immediate spinal cord impingement, nerve root impingement, people can be a candidate for the spinal cord stimulator trial. And the thing I like about the trial, it's the only thing in medicine that I know where you get an implantable device for a week and you get to try it out. So it gives patients a really good indication whether or not long-term they're going to respond to the permanent implantable device, because they have the short-term trial device that's implanted that they get for a week. They get to try it out. After the week is over, the device has to come out so they can make a decision whether or not this is good for them. Unlike a traditional spinal cord fusion or lumbar spine fusion, where you don't really get to try out the pedicle screw rod construct prior to getting them implanted. And so it turns out that historically that surgery carries about a 25% chance of really not doing any good in terms of relieving people's back pain. Furthermore, that surgery changes the biomechanics of your spine in such a fashion that roughly probably 20 to 30% of patients need to go on to a second, third, fourth operation sometime in their lifetime. It's usually a 5 to 10 year problem. So you get a lumbar fusion today, and in 5 to 10 years, you'll need another surgery. A lot of that has to do with the biomechanic changes that come with fusion, and some of that has to do with the underlying disorder that patients have, usually a degenerative process. But spinal cord stimulator is not a biomechanically change your spine in a fashion that requires more surgery in the future. So we're finding that patients can at least hopefully get good reprieve from their pain for a long period of time without going to an aggressive type surgery. So surgery for spinal cord stimulation involves really two steps. The first step is to see a pain management specialist or physiatrist, or someone who is capable of doing the spinal cord stimulator trial. And here at Rebound, those are our physiatrists. We have 3 of them who do spinal cord stimulation. And what they do is they evaluate patients for their pain, both duration, quality, and failed conservative measures. And then they try to determine whether or not they're a good candidate for the actual trial. The actual trial is an outpatient surgery. It usually takes roughly 45 minutes an hour to insert these wires next to the spinal cord. These wires exit the lumbar spine and are attached to the implantable pain generator batteries, which are taped to the back. And then you're sent home with this device in place and get to adjust it over the course of the week in conjunction with the representative from the device manufacturer. And at the end of the week, we pull these wires out here in clinic. And after that, you'll be able to make a determination whether or not the trial was good in terms of relieving your pain adequately to the point where you would consider undergoing a surgery for permanent implantation. The permanent implantation takes about an hour and a half to 2 hours to do. It's a thoracic incision, so it's up a little bit higher than people think, right about the level of your bottom of your shoulder blades. And it's an incision, and we remove a little bone to insert this paddle lead, and then the wires are tunneled underneath your skin and attached to a battery which is implanted in your flank. That battery is fairly small. It's about the size of a hockey puck, and that total procedure takes about 2 hours, and you go home that day in most cases. We actually have studied this here at Rebound, and you can look up some of the articles that we've published on this, as well as some of our YouTube educational information that we've made on our Research, Education, and Foundation website on YouTube. And we're quite proud of this, and we have had good results. The patient that does best with the permanent implant is somebody who's had greater than 50% pain relief with the trial, and they can go on and get good relief. Of those patients that we've implanted them, I would say roughly 80-90% of patients are quite happy. And then roughly 10 to 20% of patients, unfortunately, don't ultimately get the pain relief that they desired, even though they had a successful trial. Every patient's journey is very unique. And while I don't have a specific anecdotal case to discuss, I take great pride in watching people improve, regain function, enjoy their life in a better fashion, and really take pride in doing that on a daily basis.